Blurring the lines of reality. The transformative potential of mixed reality in healthcare, the landscape of healthcare, traditionally defined by tangible tools and physical spaces, is undergoing a profound metamorphosis. Driven by relentless technological innovation, the boundaries between the physical and digital are increasingly porous, giving rise to a new era of medical practice. At the forefront of this revolution lies mixed reality, MR, a compelling technology that seamlessly blends virtual and real-world elements, creating interactive and immersive experiences. Unlike its predecessors, virtual reality, VR, which entirely immerses users in a simulated environment, and augmented reality, AR, which overlays digital information onto the real world, MR goes a step further. It anchors digital objects within the physical space, allowing users to interact with both real and virtual elements simultaneously and realistically. This unique capability positions MR as a powerful catalyst for change across the entire healthcare spectrum, promising to revolutionize everything from surgical training and patient education to diagnostics, therapy, and remote care. This essay will delve into the multifaceted applications of MR in healthcare, exploring its current impact, potential future trajectories, and the inherent challenges that must be addressed to fully realize its transformative potential. Revolutionizing surgical training and planning. The high-stakes environment of surgery demands meticulous preparation, exceptional precision, and extensive training. Traditionally, surgical education has relied heavily on cadaver dissection, simulation labs, and the invaluable but often stressful experience of assisting seasoned surgeons. While these methods remain crucial, MR offers a paradigm shift in how future surgeons acquire and refine their skills. Enhanced surgical simulation. MR platforms allow trainees to practice complex surgical procedures in a realistic yet risk-free environment. By overlaying holographic representations of anatomical structures onto a physical mannequin or even empty space, trainees can visualize intricate details, understand spatial relationships, and practice critical steps without the constraints and ethical considerations associated with cadavers or live patients. These simulations can be customized to present various pathological conditions, allowing trainees to encounter a wider range of scenarios than traditional methods permit. Furthermore, MR systems can provide real-time feedback on the trainee's performance, highlighting areas for improvement and accelerating the learning curve. Pre-operative planning and visualization. Before stepping into the operating room, surgeons can leverage MR to gain an unprecedented understanding of a patient's unique anatomy. Medical imaging data, such as CT scans and MRIs, can be converted into interactive 3D holograms that surgeons can manipulate, dissect virtually, and explore from various angles. This allows for meticulous pre-operative planning, identification of critical structures, and the development of optimal surgical approaches. By visualizing the surgical field in advance, surgeons can anticipate potential challenges, reduce the risk of complications, and ultimately improve patient outcomes. MR can also facilitate collaboration among surgical teams, allowing them to collectively review the patient's anatomy and plan the procedure in a shared virtual space, fostering better communication and coordination. Intraoperative guidance and assistance. The integration of MR into the operating room itself holds immense promise. During surgery, holographic overlays can provide surgeons with real-time information, such as the precise location of tumors, critical blood vessels, or nerves, directly within their field of view. This, augmented reality surgery, can enhance accuracy, reduce invasiveness, and minimize the risk of damage to surrounding tissues. MR can also guide the use of surgical instruments, providing visual cues and feedback to ensure precise movements. Furthermore, remote experts can use MR to virtually scrub in and provide real-time guidance to surgeons in remote locations, expanding access to specialized surgical expertise. Empowering patient education and engagement. Patient understanding and engagement are crucial for successful treatment outcomes and adherence to care plans. However, complex medical conditions and procedures can be difficult for patients to grasp through traditional methods like verbal explanations and static diagrams. MR offers a powerful solution by transforming abstract medical concepts into tangible and interactive experiences. Visualizing anatomy and conditions. MR applications can create immersive visualizations of the human body, allowing patients to explore their own anatomy and understand their specific medical conditions in a way that is both engaging and informative. For example, a patient diagnosed with heart disease could use an MR headset to see a holographic representation of their heart, understand the location and nature of the problem, and visualize how a proposed treatment might address it. This level of visual understanding can significantly improve patient comprehension and reduce anxiety associated with the unknown. Explaining treatment procedures. MR can also be used to walk patients through complex treatment procedures step by step. By overlaying holographic animations and instructions onto their real-world environment, patients can gain a clearer understanding of what to expect before, during, and after a procedure. This can empower patients to make more informed decisions about their care and improve their adherence to post-operative instructions. For instance, a patient preparing for joint replacement surgery could use MR to visualize the implant, understand the surgical process, and learn the exercises they will need to perform during rehabilitation. Promoting health literacy and wellness. Beyond specific medical conditions, MR can play a vital role in promoting general health literacy and encouraging healthy behaviors. Interactive MR experiences can educate individuals about nutrition, exercise, and disease prevention in an engaging and memorable way. For example, an MR application could simulate the effects of different dietary choices on the body or guide users through proper exercise techniques, making health education more accessible and impactful. 3. Transforming diagnostics and monitoring. The ability to accurately diagnose and continuously monitor patients is fundamental to effective healthcare. MR is emerging as a valuable tool in this domain, offering innovative ways to visualize medical data and facilitate remote patient monitoring. Enhanced medical image analysis. MR can revolutionize how clinicians interact with medical imaging data. Instead of viewing 2D scans on a screen, clinicians can visualize CT scans, MRIs, and ultrasounds as interactive 3D holograms within their physical space. This allows for a more intuitive understanding of complex anatomical structures, facilitates the identification of subtle abnormalities, and improves diagnostic accuracy. Radiologists, for example, can walk around a holographic representation of a tumor, examine it from different angles, and collaborate with colleagues in a shared virtual environment to reach a more informed diagnosis. Point-of-care diagnostics. MR-enabled devices have the potential to bring advanced diagnostic capabilities to the point of care by overlaying digital information onto the patient's body. Clinicians can be guided through diagnostic procedures, such as ultrasound examinations or biopsies, with increased precision. MR can also facilitate the interpretation of diagnostic data by providing real-time visual feedback and guidance. Remote patient monitoring and telehealth. In an era of increasing demand for healthcare services and a growing emphasis on remote care, MR offers exciting possibilities for patient monitoring and telehealth. Patients equipped with MR devices can be guided through self-assessments, allowing remote clinicians to gather valuable data on their condition. Furthermore, MR can facilitate more immersive and interactive telehealth consultations. Clinicians can use holographic avatars to interact with patients in their home environment, visually assess their condition, and provide remote guidance for medication administration or rehabilitation exercises. This can improve access to care, reduce the need for in-person visits, and empower patients to manage their health from the comfort of their homes. IV. Advancing therapeutic interventions beyond diagnostics and education. MR is also finding applications in various therapeutic interventions, offering novel approaches to treatment and rehabilitation, pain management and distraction therapy. Immersive MR experiences can be used as a powerful tool for pain management and distraction therapy. Bio and occupational therapy. MR can enhance the effectiveness and engagement of physical and occupational therapy. By overlaying virtual guides and interactive exercises onto the patient's real-world environment, therapists can provide real-time feedback on movement and technique. Patients can follow holographic demonstrations, track their progress, and engage in gamified exercises, making therapy more motivating and effective. MESTA can also facilitate remote therapy sessions, allowing patients to continue their rehabilitation programs under the guidance of a therapist from their own homes. Mental health and behavioral therapy. The immersive and interactive nature of MR makes it a promising tool for mental health and behavioral therapy. MR environments can be designed to simulate real-life scenarios that trigger anxiety or phobias, allowing patients to gradually confront their fears in a safe and controlled setting. For example, individuals with social anxiety can practice social interactions in a virtual environment, building confidence and coping mechanisms. MR can also be used to enhance mindfulness exercises, provide personalized feedback during therapy sessions, and create engaging tools for cognitive rehabilitation. V. Overcoming challenges and charting the future despite the immense potential of MR in healthcare. Several challenges must be addressed to ensure its widespread adoption and successful integration into clinical practice. Technological limitations. Current MR technology still faces limitations in terms of hardware cost, user comfort, field of view, and processing power. Further advancements in hardware and software are needed to create more seamless, comfortable, and powerful MR experiences. Data security and privacy. The use of MR in healthcare involves the collection and processing of sensitive patient data. Robust security measures and clear privacy protocols are essential to protect patient confidentiality and comply with regulatory requirements. Integration with existing systems. Integrating MR technologies into existing healthcare IT infrastructure and workflows can be complex. Seamless interoperability with electronic health records, EHRs, and other medical devices is crucial for efficient data management and clinical decision-making. Accessibility and equity. Ensuring equitable access to MR technologies across different socio-economic groups and healthcare settings is vital. Efforts are needed to reduce costs, develop user-friendly interfaces, and provide adequate training to healthcare professionals. Regulatory framework. As MR applications in healthcare become more sophisticated and integrated into clinical practice, clear regulatory frameworks are needed to ensure their safety and efficacy. Collaboration between technology developers, healthcare providers, and regulatory bodies is essential to establish appropriate guidelines and standards. The future of MR in healthcare. Looking ahead, the future of MR in healthcare is brimming with possibilities. We can anticipate the development of more sophisticated and personalized MR applications that cater to the specific needs of individual patients and clinicians. The integration of artificial intelligence, AI, with MR will further enhance its capabilities, enabling more intelligent diagnostics, personalized treatment plans, and adaptive learning experiences. The